Good afternoon and welcome to our live stream today. Today we're going to be discussing tips for a better bladder. My name's Christine Burke and I'm a licensed physical therapist and a certified pelvic rehabilitation practitioner. Today we're going to be discussing ways that you can address some common bladder complaints and some things that you can try at home for addressing common symptoms. I am the clinical supervisor for the Hoag Pelvic Health Program. Hoag's Pelvic Health Program is part of Hoag's team that was named a Center of Excellence in Continence Care for Women. We have two locations, one that is in Irvine and one in Newport Beach. So a brief overview of what we're going to be talking about today. First, we're going to talk about the definition of what urinary incontinence is. Next, we're going to talk about some different types of incontinence. We'll discuss prevalence, anatomy and physiology, and causes of incontinence. Along with incontinence, we're also going to be talking about other urinary symptoms that tend to go hand in hand with urinary incontinence. And then we'll be discussing some different self-treatment techniques that you can try at home. So we'll be going over pelvic muscle strengthening, dietary modifications, and lifestyle modifications that you can do on your own to begin to address your bladder symptoms. We'll also talk about what pelvic floor physical therapy is and how it can help you to address some of these symptoms if your self-treatment techniques don't work. And we'll also go into what some other adjunct therapies are and how those might be beneficial as well. So first, for a definition of urinary incontinence. Urinary incontinence is the accidental or involuntary loss of urine that can be felt or seen. This ranges from very rarely and just a few drops to having full accidents regularly. We always want to stop and make the point here that urinary incontinence is not a normal result of aging. So oftentimes we'll have patients say to us, yeah, I leak a little bit when I cough or when I sneeze, but kind of normal for women my age, for example. We do want to make the point that while it's common, it's not necessarily normal, and there are treatments out there that can help to address these symptoms, so it's not something that you have to live with. Urinary incontinence can be really distressing to patients that experience it. It can impact decisions that they make as far as where they want to travel, what social outings they do or don't want to participate on, if they want to join families for meals, if they want to go on family vacations, and so it can be very pervasive to their quality of life. As far as prevalence of urinary incontinence and who reports urinary incontinence, we do know that throughout the lifespan, about 14% of males and 50% of females will report incontinence. However, it's important to note that while adult women do report urinary incontinence more commonly than males do, for males it can become a more prevalent issue as they age. So as men get older into the 70s and 80s, we tend to see more incontinence there. 40% of all women after childbirth will report urinary incontinence. 47% of women after a hysterectomy will report urinary incontinence. And 50% of middle-aged and older women will report incontinence. 40% of women participating in high-impact sport or activity, and these aren't necessarily just your Olympic athletes. These can be women just participating in running, boot camp classes, CrossFit-style exercise, spinning. And we do know that with men, post-prostatectomy urinary incontinence is very common as well. As far as different types of incontinence, so you can have basically two big different types of incontinence. So the first type of incontinence is called stress incontinence, and this is leaking with an increase in abdominal pressure. So these are people that will tell you, I leak urine when I cough, when I sneeze, when I lift. This tends to be smaller amounts of incontinence. The second big type of incontinence is urge incontinence, and this is an abrupt and strong urge to urinate and you didn't make it to the restroom. So someone might say, anytime I really have to go to the bathroom, I'll get there and I'll lose a few drops on my way, or I'll just get to the restroom and I won't be able to quite make it. Mixed incontinence would be a combination of these two types of stress and urge incontinence. So anyone that experiences both, we would call that mixed incontinence. And functional incontinence means you're not able to make it to the restroom in time due to orthopedic or neurological impairment. So if someone isn't able to walk quickly enough to get to the restroom, that would be a functional incontinence. If someone has lost dexterity in their hands and they're not able to undress quickly enough, that would be functional incontinence. And I do want to mention as well, if there are any questions coming up right now, we will leave time at the end of our live stream here for some Q&A. So if you have any questions that are coming up, please feel free to type those in the chat and we'll address them at the end of our live stream. As far as other symptoms associated with incontinence, and these symptoms can be standalone as well, so someone can have these symptoms without actually having incontinence. So a big one for us would be urinary urgency. This is a sudden and overwhelming need to urinate. You feel like you have to go right now. There is absolutely no deferring, feeling like, okay, I could go to the restroom and then trying to find one. When you have to go to the bathroom, you have to go right then. Frequency is another symptom associated with incontinence. So this would, when we always get the question, how often is too often? So as far as normal urinary frequency, so we define normal urinary frequency as urinating less than 8 times in a day is what we would call normal. So if you're urinating more than 8 times in a day, we would define that as increased urinary frequency. And a normal interval is every 2 to 4 hours. So if you aren't able to go at least 2 hours in between voids, we would call that increased urinary frequency as well. And last but not least, we do tend to see nocturia go hand in hand with frequency as well. And nocturia is waking up more than 2 times a night to urinate. So ideally we want to see people waking up 0 to 1 time at night to urinate. Up to 2 can be normal in some of our older patients, but anything more than 2, and we would call that nocturia. So we will take a brief look at our urinary system here. So just to kind of lay the land as far as our anatomy goes. So getting a basic look here. So on either side of the screen, up kind of in the middle of our body, we have our kidneys, and that is where urine is actually made. And then we have our ureters. Those are coming down the body there, those yellow tubes. The ureters are what transports urine that has been made in the kidneys down into the bladder. Right just above the pubic bone there, we have our bladder. This is where urine is stored, and it is meant to be stored there. So we should be able to hold on to that for about 2 to 4 hours. It does expand. And then coming out of our bladder, we have the urethra, and the urethra is what carries the urine from our bladder outside of our body. So looking at our bladder, we want to talk a little bit about bladder function. I know I just mentioned it's a storage organ. So let's talk about the bladder function and how it's meant to work. So your bladder is a storage reservoir, which means it should be able to store about 400 to 600 milliliters or 13.5 to 20 ounces of fluid. The bladder fills at a rate of 15 drops per minute. Okay, so the way that the bladder normally works is, you can see number 1 there on our photo. The bladder begins to fill again at that rate of about 15 drops per minute. Our detrusor, which is the muscle around the bladder, that muscle is relaxed. Now, an important point to make about the detrusor muscle is that we don't have voluntary control over it. So our nervous system has control over the detrusor muscle. So as the bladder is filling, the detrusor is relaxed. Once you hit 400 milliliters or 13.5 ounces, you get that first sensation of, oh, you know what, I actually could use a restroom if we find one. So you have that little sensation to void. When that happens, so your detrusor muscle is relaxed, and your pelvic floor muscles, which we'll talk about the anatomy of your pelvic floor in just a minute, but your pelvic floor muscles are what supports the outside of the urethra, your external urinary sphincter. So when your detrusor muscle is relaxed, your pelvic floor muscles are contracted. So that means urine is staying inside the bladder where it belongs. When you get that first sensation to void, that first sensation that you feel is actually a little bit of a contraction from the detrusor muscle. So once you hit a minimum capacity for your bladder, let's say it's 400 milliliters, the detrusor muscle, that stretch reflex in the detrusor muscle is activated. It then contracts a little bit, and you get that sensation that you feel like you could use the restroom. Bladder's about only half full, so it shouldn't be, a super strong sensation, but you just feel like you could go. As the bladder continues to fill, that urge gets a little bit stronger, and then we find a restroom, and when we tell our body, okay, we're going to empty the bladder now, what happens is your pelvic floor muscles relax. That opens up the urinary sphincter. That sends a signal to your brain and tells your bladder, now's a great time to go. The detrusor muscle contracts and completely empties the bladder. So more than anyone probably ever wanted to know about the way that urine is made and stored and then expelled out of the body, but it's an important point to kind of review, just because as we go into some of these self-management techniques, we want to kind of understand why these things work. So again, first desire to void is at 150 to 200 milliliters. We always like to let people know too, it does take 3 hours for your bladder to fill. So a lot of times when we talk about the need to stay hydrated and needing to drink enough water, patients will tell us, I feel like if I'm going somewhere in an hour, I try not to drink anything leading up to it because I don't want to have to find a restroom. It is important to note it takes about 2 hours from when you drink something to when it gets made into urine and moved to the bladder. And then it takes about 3 hours for the bladder to fill. So we oftentimes have more time than we think we do in terms of needing to use the restroom. When the bladder is about 75% full, the stretch reflex is activated. Again, that's that urge that you feel to urinate. Pelvic and sphincter muscles contract to hold the urine, and then when we sit down to void, a signal to our brain is given. Pelvic muscles relax, the detrusor contracts, and urine exits. So I know we've been talking a little bit about the pelvic floor muscles already, and the pelvic floor muscles being an important part of that urinary sphincter. So let's just kind of review some brief pelvic muscle anatomy. So your pelvic muscles are a group of muscles that sit at the base of the pelvis. They attach from the pubic bone to the tailbone. There are 3 layers to the pelvic floor muscles, and they work very closely with the bladder to control urination. So we can see on our diagram here, we're kind of looking right at a patient here, and so their legs would be kind of the upper right and left of the photo here. So just in terms of getting oriented, the top of the screen there would be like where the pubic bone is, and then the bottom of the screen would be where the tailbone is. So your pelvic floor muscles are what surround the external urethral sphincter. They also surround the external anal sphincter. And your pelvic floor muscles are what open. So when your pelvic floor muscles relax, that is what opens up those sphincters. And when your pelvic floor muscles contract, that is what closes those sphincters. So I know I mentioned earlier your detrusor muscle is it's not under voluntary control, it's controlled by the nervous system. So that's just the muscle that's around the bladder. The urinary and anal sphincters are controlled. You do have voluntary control over that, so those are controlled by your pelvic floor muscles. So just important to kind of, when we talk about the pelvic floor muscles and where they are, important to understand what muscles that we're referring to. I always tell patients myself, if you were to sit on a saddle, everything that touches the saddle underneath that is where your pelvic floor muscles are, okay? And you can see kind of at the top of the photo there, you can see just how they surround that urinary sphincter there to give it some support and structure. And then as far as pelvic muscle function goes, so these are an important muscle group. They have a few really important functions. So we've been talking a lot about they do have sphincteric control, so they help to control they do control the urethral and anal sphincters, help us maintain bowel and bladder continence. They're involved in sexual function. They're part of your core stability. So they're actually a deep stabilizer muscle. So oftentimes when we talk about the core muscles, people tend to think about your abs. Your deep core muscles is actually a group of muscles more than just the abs. So the transverse abdominis is part of that muscle group, but so is your diaphragm, so are your pelvic floor muscles, and so are the multifidi, or the little muscles that go up and down your spine. And so it's important to note that it's part of the core muscle group, because when we're talking about something like stress incontinence usually comes from someone not being able to manage intra-abdominal pressure. And so we try to leverage the strength of the whole core muscle group to address that rather than just the pelvic floor. And then last but not least, your pelvic floor muscles also provide support to your pelvic organs. So for your pelvic organs, your pelvic floor muscles are kind of a secondary support in keeping everything inside of the pelvic cavity where it belongs. So where can it go wrong? So there are a number of things that can happen over the lifespan that can impact our ability to maintain bladder continence. The two big ones that we're going to focus on today are pelvic muscle weakness and diet and lifestyle. So that's where our focus will be for today's live stream. That being said, if we do make some recommendations of things that you can try at home to address this. If that doesn't work for you, then we would recommend following up with your doctor as well. We can also have issues with pelvic floor dysfunction, pelvic organ prolapse. There can be prostate issues. There can be cancer surgeries or radiations that might contribute to some of this. Postpartum, there can be muscle and nerve trauma or damage. We can have menopausal changes, hormonal changes, changes in the vaginal tissues. Certain medications can cause incontinence, as well as certain medical conditions like COPD, sleep apnea, OAB, diabetes, stroke, Parkinson's disease, or multiple sclerosis. Okay, so as you can see, there's a number of things that can impact this, but today's big focus will be pelvic muscle weakness and diet and lifestyle. So as far as self-treatment goes, the first thing, if someone's experiencing urinary incontinence, one of the first things that we want them to try is strengthening their pelvic muscles. Strengthening the pelvic muscles remains a first line of treatment for urinary incontinence. There's very strong support in medical literature validating the use of strengthening the pelvic muscles to address urinary incontinence. And when we say strengthening your pelvic floor muscles, what we mean is that you're going to be trying Kegels, right? So many of us have heard of Kegels, and by the end of today's live stream, you will be an expert in how to do a perfect Kegel. And then again, self-treatment also means dietary and lifestyle modifications. So these are things that you can try right away today after today's live stream to start addressing some of your bladder symptoms. So as far as strengthening the pelvic floor muscles, so a proper pelvic muscle contraction, we want to make sure that we're able to do that. So this is a Kegel. So we want to make sure that we're able to do a proper pelvic floor muscle contraction before we start strengthening, because if you wanted to get better at squats and you started practicing doing calf raises to get better at your squats, you would be addressing the wrong muscle group. And so oftentimes with our patients, we want to take the time to make sure that you're doing a Kegel properly and correctly, so that if you're doing them at home, you know that your time isn't wasted. You're addressing the muscle group that needs to be strengthened. So what I always like to tell people as far as how to do a proper Kegel, you want to imagine that there's a zipper that runs from your anus up to your pubic bone, kind of like where the seam of your pants would run. And when you go to contract, you want to think about starting at the back of the zipper and drawing up and in to draw the zipper closed all the way to the front of the pubic bone. Some other cues that we'll give people are to imagine stopping the flow of urine or preventing yourself from passing gas. You can tell yourself to think of tucking the pubic bone and tailbone underneath. Think of picking up a marble with the pelvic muscles. Think about lifting your underpants away from your chair. For women, we can tell you to think of zipping up the labia from the perineal body to the pubic bone and nodding the clitoris. And for men, sometimes we'll tell you to think of shortening the penis and lifting the testicles. Now, one big thing I want to mention here, so obviously with you at home, I think everyone's probably practicing their Kegels right now. And if you are, one thing I want to mention is you want to be very, very careful that you're not doing these incorrectly. And one of the biggest things that we see go wrong with these is using other bigger muscles to try and supplement this contraction. So what happens oftentimes is people say, okay, if I am doing an exercise, it should be very obvious that I'm exercising. I should be turning red in the face. I should maybe have a vein popping out. Something should be moving. You should know that I'm contracting. And really with Kegels, it's a very subtle contraction. So you shouldn't feel a lot of movement in other parts of the body. So one important thing, if you're seated right now and trying them, one thing you want to keep in mind is we don't want to squeeze the thighs. We don't want to squeeze our butt, right? So my head shouldn't be raising as I'm doing Kegels. We don't want to squeeze our abs. We should really just feel like we're isolating those pelvic floor muscles. If you If you are feeling a little bit of activation in your abdominals, that's okay, because your pelvic floor muscles do co-contract with your transverse abdominis, and so you will feel a little bit of like an engagement within your abdominals, but you shouldn't feel like you're doing a sit-up or crunching or anything like that. Okay, so again, for that perfect, proper Kegel, we want to start at the back of the zipper. There's a zipper running from the anus up to the pubic bone. Start at the back of the zipper, draw up and in, and draw that zipper closed. So again, our big do nots. So we want to make sure that we aren't holding our breath. So holding our breath actually places, you can see in the diagram that's up on the screen right now, holding our breath places a lot of downward force on the pelvic floor muscles and can actually create urinary incontinence. So don't hold your breath when you're doing these. You don't want to have a lot of activity in other parts of the body. So again, we shouldn't be squeezing our thighs, squeezing our glutes, squeezing our abs. We should really just isolate the pelvic floor muscles. If you are leaking urine when you're doing a pelvic floor muscle contraction, you are doing the opposite. So you're not doing it quite correctly. So you want to stop and reset. And if you continue to leak urine while you're doing the pelvic floor muscle contraction or the Kegel, you'll want to talk to your doctor and possibly see a pelvic physical therapist so that they can help you coordinate those muscles. Another important point to mention with this too is not doing a pelvic floor muscle contraction on the toilet. So for a long time, people were told, practice your Kegels while you're urinating. It'll help you to know that you're locating the right muscle group. This can actually lead to retention, and so it's really important that we don't do our pelvic floor muscle contractions on the toilet because of that mechanism that we talked about earlier on, where we said that, when the pelvic floor muscles contract, when the pelvic floor muscles relax, the detrusor contracts, and that helps to empty the bladder. If you continually contract your pelvic floor muscles while you're urinating, that can mess with the signal between your brain and bladder and can lead to urinary retention. So definitely do not do your pelvic floor muscle contractions while you're urinating. Functioning pelvic muscles work with our breathing patterns, right? So we said we don't want to hold our breath while we're doing our Kegels, but you can use your breath to help you coordinate this contraction. So the way that works is when we inhale, we want our, typically when we inhale, as you can see in the photo on the screen right now, our diaphragm and our pelvic floor muscles move down, when we inhale. And then when we exhale, our diaphragm and our pelvic floor muscles move up. So we want to inhale, relax, right? So when we're inhaling, the belly should move out, our pelvic floor muscles dropping and relaxing. And then as we exhale, that's when you'll notice the pelvic floor muscles lifting and the belly should be coming back in, okay? Functioning pelvic floor muscles work together with the muscles of the abdomen, the legs, the arms. So it's important to isolate and strengthen your pelvic floor muscles with Kegels, but you also want to keep in mind that your pelvic floor muscles are part of your core muscle group. When you're up, walking around, picking things up, doing housework, gardening, going grocery shopping, doing all of these activities, all of your core muscles are working, including your pelvic floor muscles. So from our pelvic floor, we need the right amount of force at the right time to help us to prevent urinary incontinence. And that's where isolating with Kegels can help to just strengthen the pelvic floor muscles, but then eventually we do need them to work with the rest of our body. So as far as sets and reps, now that you're hopefully doing a perfect Kegel, so as far as sets and reps, we have a couple different types that we like people to do. So the first is a quick contraction where you're going to contract the pelvic floor muscles and just hold for a second. And you're doing 2 to 3 sets of 10 of these daily. These quick contractions, you want it to literally be a set of 10 as fast as you can do them. If you're just starting out, you may not be able to do them that quickly, but eventually we want to get to the point where you can do a set of 10 in 10 seconds. So we always like to start people 2 to 3 sets of 10 repetitions of the quick Kegels each day, and then our slow contractions as well. So we want 2 to 3 sets of 10 where you're holding for 10 seconds and relaxing for 10 seconds. You can also do, for motor control, you can do what we call an elevator contraction, where if you have really good control and awareness of your pelvic floor muscles, you can think about, okay, what's completely relaxed and what's contracting as hard as I can, and then what's halfway in between. So I'm going to contract from 0% to 50% to 100%, back down to 50, back down to 0, right? And so that's called motor control, and that's where we're working on, finding different contractions between just on and off, right? So can you fire just a little bit if you need it? And we often do need that for day-to-day continence. We can also work on functional contractions. So when do you leak? So if you only leak with cough or sneeze, you can actually practice contracting your pelvic floor muscles and then coughing or sneezing. We always tell people squeeze before you sneeze. But you can actually practice doing those things with a Kegel beforehand to help maintain continence. We do know that a sneeze can put upwards of 70 miles per hour of downward force on the bladder and the urethra, which is a lot. So oftentimes we do counsel people, most people should be contracting with their sneeze if they can feel it coming, because it just provides enough support to that urethra to help you maintain continence. If you have leakage with lifting, maybe picking things off the ground, sit to stand, rolling in bed, we would encourage you to do a Kegel prior to that activity to help maintain continence. So our overall goal here, when we're looking at strengthening the pelvic floor muscles, we're looking at 60 to 80 contractions daily. So research shows us that if you're doing less than 60 contractions each day, you're not actually doing enough to truly improve strength of the muscles. But if you do beyond 80, you're doing too much. So you want to think of it as, if I wanted to get better at push-ups and I did 200 push-ups a day, at a certain point I'm exposing myself to injury. So beyond 80 contractions each day can create an injury, and we want to be very mindful of not doing more than that. But again, less than 60 just isn't quite enough to truly get strengthening benefits. And so we find that that 60 to 80 range is really that perfect range where you're going to reap the benefits of strengthening without creating an injury. So just important to keep that in mind. Okay, so those are kind of all of our information as far as the basic strengthening that we'd want to start you on. So for sure, if you guys have any questions about that, make sure to type it in the chat so that we can address it at the end of our live stream here. And then as far as what we're going to be moving into next, so we are going to talk a little bit about self-treatment and dietary modifications. But first, I'm going to go over just a quick question as far as the strengthening goes. So the first question was, I've never been able to hold very much urine. I was using poise pads for years. After I had a stroke, I don't have much control and have to use Depends. I go a lot at night. Is there hope for me? This is a really good question. We do get this question a lot as far as whether or not someone should try pelvic physical therapy or whether or not they should address some of these symptoms. It's important to note that regardless of what's going on, so whether this person has had a stroke, we've had patients that have maybe Parkinson's disease or they have significant prolapse. If your pelvic floor muscles are not normal strength, providing strengthening for them and getting them up to normal strength will always lead to some improvement in symptoms, right? So we want to normalize no matter what's going on, no matter what the challenges are. We always want to normalize everything with the pelvic floor. And in more cases than not, if we normalize the strength of the pelvic floor muscles, there's going to be some change in symptoms. It might not completely take the symptoms away, but it would be really rare to go from weak pelvic floor muscles to strong pelvic floor muscles with no change in symptoms whatsoever. So thank you so much for that question. There is definitely hope in that case. And then we had another question regarding UTI and incontinence. Absolutely, there is a link here. So anytime that there's any kind of infection in the body, there can be inflammation as well. That inflammation causes your pelvic floor muscles to not work as well. And then that irritation as well can lead to incontinence. So there is definitely a link there. And then we had another question. My question is about incontinence that only happens with a full bladder. That is a great question. So we can see those, we can see that kind of in two different ways. So sometimes we'll have someone that has stress incontinence, but they only have stress incontinence when they have a full bladder. So let's say they sneeze and their bladder is only half full, they're totally fine. But if they have to sneeze with a full bladder, that's when they're going to have leakage. And then we can also have people who, if they get a really strong urge and their bladder's full, that's when they're leaking, versus if they get a strong urge and their bladder doesn't feel that full, they don't have as many issues. Regardless, those things all respond well to strengthening. with the stress incontinence that only happens with a full bladder, that typically what that means is that you have somewhat strong pelvic floor muscles, but they can't overcome the weight of a full bladder with the increase in intra-abdominal pressure. So regardless in that scenario, strengthening, an initial bout of strengthening would definitely be indicated. Okay, so we will look forward to more questions at the end of our live stream here. We're going to move into talking about self-treatment techniques and dietary modifications. So before I go into this list, I do want to say a lot of these I know can be difficult things to cut out of your day-to-day. So we always advise people, you know, start with the strengthening exercises. Do those for about 4 weeks, and if the strengthening exercises don't seem to be improving your symptoms, then you can look more into some of the dietary modifications. So we want to limit or avoid the following. So these things are known to be bladder irritants: caffeinated beverages, including coffee and tea; carbonated beverages, including the carbonated waters. I do get that question a lot, whether or not the LaCroix or the bubblies, the carbonated waters do count as a carbonated beverage. Alcohol, artificial sweeteners, spicy foods, and citrus foods or beverages. So these things are known to be bladder irritants. So oftentimes what we'll recommend is if the initial strengthening doesn't seem to improve the symptoms, we can try avoiding these things for 2 weeks. And if your symptoms get better, you can slowly reintroduce them one by one to see if you can isolate what it is that's causing the issue for you. As far as lifestyle modifications go, one of the biggest things that I always talk about with my patients, one of the most important things you can do is drink enough water. So especially when you're experiencing things like urinary incontinence, frequency, urgency, anything along those lines, we often will have patients say, you know, I limit my fluid intake because I don't want to have to run to the restroom all the time, or I'm limiting my fluids because I don't want to continue leaking so much. Concentrated urine is actually a massive bladder irritant, and so concentrated urine is much more likely to make it can exacerbate these symptoms. And so it's really, really important to make sure that you are drinking enough water. So we always tell people aim to drink half your body weight in ounces. So if you weigh 120 pounds, you want to drink about 60 ounces of fluid a day. The other important thing there is that you want to avoid drinking large amounts of fluid all at once. So sometimes we'll tell people, okay, your goal is 60 ounces, and they'll say, well, I got home last night and I'd only had 30, so I drank 30 ounces of water with dinner. Ideally, we want you to kind of sip water throughout the day rather than drinking it all at once. Especially for those experiencing nocturia, we do want to reduce our fluid intake after dinner. So we start to get really picky when we talk about hydration. We want you drinking X amount of water. We don't want you drinking it all at once. And then we also want you stopping drinking it about 2 hours before dinner. We also want to avoid using the restroom just in case. So bladder habits are they're habits oftentimes. And so going to the restroom all the time just in case you have to go can actually contribute and exacerbate frequency as well. We want to avoid smoking, address a chronic cough, and address swelling in the legs. And then as far as the hydration goes too, going back to that, as far as the hydration goes, I always tell people too, a great barometer is just what your urine looks like. So if your urine is relatively clear and odorless, you're doing a great job with hydration, keep it up. If your urine is a darker shade of yellow or has a strong odor, you probably need to up the water intake a little bit. If your water, let's say you're drinking a ton of water and your urine looks like water itself, and then you're going more than every 2 hours, then you may be drinking a little bit too much water and you would want to back that off a little bit. So I always tell people, use your urine as kind of your barometer. That'll be a great snapshot as far as how well hydrated you are that day. We also always advise people we want to reduce constipation and straining with bowel movements. So constipation and straining with bowel movements can create a lot of pressure on the bladder and can contribute to leakage. So helping with constipation, we can increase our activity level, we can try some colon massage and proper positioning. And our photo there gives us a great snapshot of what proper positioning looks like. So modern day toilets are actually a little bit too high for how our anatomy is set up. We actually want want to have our knees above our hips and leaning slightly forward. By doing that, so you can use like a stool or books underneath your feet to bring your knees up above your hips, and then combining that with leaning forward, that actually mimics being in the bottommost squat position, which is optimal for defecation. That's kind of how we get our best bowel emptying. So if you are someone that's struggling with chronic constipation, we can look at positioning, and that can make a huge difference. We do know as well that increased body mass index is a risk factor for urinary incontinence. So studies have shown that BMI over 30 can place you at a greater risk for incontinence. The reason for this is there's a lot of intra-abdominal pressure, with increasing BMI, and so that can create a failure there in the continence system. It can also contribute to what we call urethral hypermobility, which makes it very difficult to control the urine. So maintaining a healthy weight through diet and exercise can also help to reduce urinary incontinence as well. We also tend to work with our patients on what we call bladder training. So maybe you're someone who doesn't have a lot of urinary incontinence, but you're someone who's going to the restroom 15 times a day. You feel like you're always going to the restroom. With these patients, we'll have them do what we call urge suppression or bladder training. So essentially what we want to do is so if you get the urge to urinate and you run to the restroom right away and are rushing off, what that does is that feeds into the nervous system loop and basically tells your body that anytime you have to urinate, it's an emergency. And so your urges that you get start to feel stronger and stronger. So we want to break into that feedback loop a little bit. So how do we do that? So what do I do if I have to go right now? So what we like people to do is we want them to stop what they're doing, stand still or sit down, and do 5 quick pelvic muscle contractions. So after 5 quick pelvic muscle contractions, again, we're utilizing that detrusor pelvic floor connection. So just like when our pelvic floor muscles relax, our detrusor contracts and empties the bladder. When our pelvic floor muscles contract, that sends a signal to our brain that tells the bladder, now is not a great time to go, and the detrusor actually relaxes. So and it cuts down on some of that urge. So we are utilizing that feedback loop for our good here. So 5 quick pelvic floor muscle contractions. Distract your mind. You can try counting backwards from 100 by 7s. You can try naming past presidents, and go back to what you were doing. Wait, and if the urge subsides, then what you're going to do is just continue to do what you're doing and don't go to the restroom. So as long as that urge has gone away, then go back to what you were doing and wait until you feel another urge. If the urge has not gone away with the urge suppression techniques, then you want to slowly and calmly walk to the restroom. It's very important to note, even if the urge doesn't go away, you don't want to rush off to the restroom, because if you rush, it'll again feed back into that nervous system upregulation and feeling like you have to go right that second. So try as hard as you can to slowly and calmly walk to the restroom. Sometimes too, we'll advise people to keep what we call a bladder diary. So this is right here. There's an example of this right on the screen. And basically what a bladder diary is a 24-hour snapshot into what goes in and what goes out for that day. So we ask people for each hour to log what they drank, how many trips to the restroom they had in that hour, did they have a strong urge, did they have any leaks, and what were they doing at the time. So sometimes with bladder symptoms, people can have trouble identifying a pattern, and what the bladder diary does is it can help to see a pattern. And so we would recommend that you try the bladder diary as well to help identify any patterns that you might see. Sometimes it'll help if I have patients that don't want to give up coffee, for example. Sometimes it helps to see on paper that, okay, yeah, that really does make a difference. So I would encourage anyone, if you're having trouble finding a pattern to your bladder symptoms, the bladder diary can be really, really beneficial as well. And then beyond strength. So we talked about our self-treatment techniques. So we talked about strengthening the pelvic floor muscles. We talked about diet and lifestyle modifications that you can make to address these symptoms. So what we would recommend, we do know that for the pelvic floor muscles, you need about 12 weeks of isolated strengthening to be able to make true changes in strength, but we like to see progress in about 4 weeks. So if you're doing the pelvic floor muscle strengthening for 4 weeks and you don't notice any difference, I would move on to address any diet and lifestyle modifications that you could make. And then if after another 4 weeks of that, if you're still not seeing symptoms, I would recommend following up with a doctor, either your primary care physician or a urologist as well can help to get to the bottom of these symptoms. And then if they were to say, I want you to try pelvic physical therapy, and you've said, okay, I've already done my 4 weeks of Kegels, what's the difference of trying, formal physical therapy? So the pelvic physical therapist is going to be able to provide one-on-one training for strength, endurance, and coordination. So oftentimes with patients that haven't done well with Kegels on their own, what we see is that they actually, their strength's okay, but they don't have great endurance, or their strength's okay, but they aren't able to relax completely. So remember, a proper Kegel is not just a full contraction. A proper Kegel is a full relaxation afterwards. So if someone isn't fully relaxing, that could be why they're not improving with Kegels. They could have issues with pelvic muscle tightness, right? So if someone has pelvic muscle tightness, doing Kegels is only going to make the problem worse. We do see patients that have incontinence with pelvic muscle tightness, and the reason is when the pelvic floor muscles are tight, they don't have the range of motion that they need to be able to actually close off that urinary sphincter. So just because the pelvic floor muscles are tight doesn't mean that you can't have urinary incontinence. And tight pelvic floor muscles do tend to feed into urinary frequency and urgency as well. So you might need someone that needs pelvic muscle relaxation, and a pelvic floor physical therapist can do that. There might be some asymmetry of the pelvic floor muscles, so you do have left and right pelvic floor muscles, maybe one side stronger than the other. The pelvic floor physical therapist can do biofeedback, body mechanics training. They can look into any other orthopedic considerations, like if there's any hip or lumbar issues that might be contributing. And they can also go through some advanced exercise and Pilates-based exercises that can help address the symptoms as well. So that is one important thing, though, that we do want to note. Just keep in mind a proper Kegel is a full contraction followed by a full relaxation, and you definitely should not have any pain with Kegels. And if you do, you want to stop and talk to your doctor, because you're probably a great candidate for physical therapy. And then as far as adjunct treatments go as well, we do know that there are some other treatments that tend to pair nicely with pelvic floor physical therapy. For those that are either not responding to pelvic floor physical therapy or who aren't getting who want to get better a little bit faster, things like acupuncture, nutritional counseling, Pilates, and counseling can all be really helpful as well. And we do have all of those services actually at the Hoag Pelvic Health Program. So again, the Hoag Pelvic Health Program has locations in Irvine and Newport Beach. We are co-located with the Hoag for Her Center for Wellness. And we do have all of those wellness services that I just mentioned in-house. We work really closely across disciplines. Our physical therapists work with all the different providers to help coordinate care so that we're addressing whole person as opposed to just symptoms. And again, Hoag is a nationally recognized center of excellence in continence care for women. Our Hoag Pelvic Health team is part of that center of excellence designation, and so we do work closely with a number of urologists and pelvic medicine surgeons within the organization, and we do all work together to provide the best possible outcomes for our patients that are struggling with incontinence, urgency, frequency, any bladder related issues. Okay, so we have hit quite a bit. So I am going to pause and give some time for questions here. So thank you all for sending your questions in via the chat. We appreciate that. So starting things off here. Difficulty emptying the bladder completely. So if someone is having difficulty emptying the bladder completely, you would definitely want to make an appointment with a urologist or talk to your primary care physician about making an appointment with a urologist. If you're having trouble emptying the bladder, you'll want to do a full urology workup and just kind of make sure they'll take you through some different testing to see if the bladder's emptying, how much it's emptying, make sure everything's working. But tight pelvic floor muscles can contribute to difficulty emptying the bladder as well, because what happens is when the pelvic floor muscles are tight, it makes it hard for the urethral sphincter to open completely, and it'll make you feel like you're never able to really empty the bladder. So again, if that's something that you're struggling with, make sure you talk to your doctor, make sure that you're evaluated by your doctor or by your urologist, but pelvic floor physical therapy might be a good option in that case as well. Does it still make sense to do pelvic therapy after 2 years after delivery or even longer? Absolutely. So pelvic floor muscles your muscles can always improve. So if you started experiencing urinary incontinence after delivering a baby, regardless of how long it's been, the strength and the quality and the function of your pelvic floor muscles can always improve if there's a dysfunction. And so I would definitely say if that's something that you're struggling with, even if it's been 2 years, even if it's been 10 years, even if it's been 20 years, I would still say I would try pelvic therapy, because the pelvic therapist will, on their first visit, they'll do an assessment of your pelvic floor muscles, and they'll be able to tell you, yes, you have 3 out of 5 strength. And so if you have a strength deficit, it would always make sense to do pelvic therapy, because you'll be able to strengthen. And again, it would be really rare to have someone who we normalize everything with their pelvic floor and their symptoms don't at least improve, if not resolve altogether. Next question. I've seen Kegel tools for sale to exercise the muscle. Are these a waste of time versus the strengthening exercises shown here? That's a really great question. There are various things out there. There's a couple of different kind of products out there that they're basically like a home biofeedback unit. They pair with your phone, and they will tell you to do your Kegels and if you're doing them correctly. The products that are out there nowadays are really good, to be honest with you, but you don't need them. We rarely tell people that they have to get them. If you're someone who you feel confident that you're doing your Kegels correctly, and you're someone who can be really diligent with your exercises, I don't think you need them. I don't necessarily think they're a waste of time, because it's ultimately strengthening, just like what we're doing here, but it's also an additional cost that everyone doesn't necessarily need to incur. And how high is the footrest for the lifestyle modification? So the footrest for constipation. So it will depend on your personal height. So basically the goal for the footrest is we want to get your knees up high enough that they're above your hips. So that might be 6 inches, that might be 8 inches. It'll be different for everyone, but the real goal is that you want your knees above your hips. So when your feet are up on the footrest, you want the knees above the hips and make it easy for you to lean forward. So as long as your knees are above your hips, then it's definitely high enough. Okay. Any other questions? Perfect. Okay. Well, we want to thank you guys for joining us today. It was a pleasure getting to be with everyone, and have a wonderful rest of your Thursday.